Hi, I'm Dr. Emily Guarnotta, and I'm a licensed psychologist specializing in perinatal mental health. Let's talk about postpartum depression. What is postpartum depression? Postpartum depression, or PPD for short, is a type of mood disorder that affects around 1 in 5 new mothers. You can develop PPD at any point within the first year of giving birth. Symptoms can include feeling sad, anxious or irritable, changes in sleep, weight, or appetite, low energy, feelings of guilt or worthlessness, difficulty focusing, and even suicidal thoughts. What causes postpartum depression? PPD is caused by a combination of biological, psychological, and environmental factors. Genetics, changes in hormone levels, and sleep deprivation all play a role. The stress of caring for a newborn and coping with a massive life change also contribute. Some women are at greater risk of PPD, including anyone with a prior history of depression or anxiety or a lack of support. Can postpartum depression be prevented? PPD may be preventable. The first step is being aware of your risk. Women with low self-esteem, marital problems, poor support system, and a history of anxiety and depression have a higher risk of developing PPD. If you're concerned about your risk, there are steps you can take to help prepare. Taking these actions can reduce the likelihood that you experience PPD. It's important to remember, though, that even if you take every precaution, there's still a good chance that you could develop PPD. Some factors may be beyond your control. If you do end up developing PPD, treatment is available. Whether or not you're at risk for PPD, you can benefit from taking steps to prevent it. Here are 8 strategies to prevent PPD. Number 1, talk to your medical team. If you think you might be at risk of PPD, it can help to alert your healthcare providers. They'll be able to monitor you more closely for signs of PPD and intervene if necessary. If you notice yourself feeling more sad, worried, or irritable than usual, you should bring this up sooner rather than later. Number 2, get active. Exercise is an effective tool for achieving greater well-being during pregnancy and the postpartum period. Studies on the effects of exercise for postpartum women have found that it can help alleviate depression and also help prevent it from developing in the first place. Number 3, rest. This tip may seem contradictory following the previous one, but rest and good sleep are important for physically and emotionally recovering from childbirth. In many cultures, women are encouraged to rest during the postpartum period, and family and friends help out. If you're feeling tired or overwhelmed, practice asking for what you need and set your own limits. Number 4, eat a healthy diet. Getting adequate nutrition can also help prevent and alleviate symptoms of depression. Low levels of certain nutrients are linked to depression. Be sure that your healthcare provider checks your blood work after giving birth to ensure that you are getting the proper nutrition. Number 5, seek breastfeeding support. Breastfeeding is a way to connect with your baby and provide nutrition, but it can also be a source of stress, especially if your baby struggles to nurse properly. Experiencing challenges while breastfeeding are more common than most women realize. Many women blame themselves for hitting roadblocks, which can cause feelings of guilt and shame and further fuel depression. If you're finding breastfeeding challenging, it's important to seek help. If you're struggling, consider meeting with a lactation consultant or attending a breastfeeding support group. Number 6, ask for help. There is a reason why we say it takes a village. Caring for a newborn is a lot of work, and having the help of others around can make a big difference. If you're feeling overwhelmed by the demands of motherhood, don't hesitate to ask for help or do accept help when it's offered. Number 7, take time to connect with your baby. The demands of caring for a newborn can be so overwhelming, which can make it hard to initially bond with your baby. Taking time to connect with them can help you feel more attached. Skin-to-skin contact is an effective way to improve your sense of connection with your baby and also reduce stress and depression for yourself. Make an effort to give yourself some time each day to be present and connect, even if that means putting off chores or other responsibilities for the time being. Number 8, talk to other mothers. A lack of support during the postpartum period can increase the risk of PPD, while having a good support system can help prevent it. Even though support is so important, finding time to spend with loved ones during this time can be challenging. If you're feeling lonely or isolated, make an effort to reach out to one new connection each day. You can also consider joining an online or in-person support group for postpartum mothers. Even if you follow all these tips, you may still develop PPD. But remember, postpartum depression is is treatable. There is no reason that you have to suffer alone.